It is my honor and pleasure to welcome you to this side event. We are doing this side event together with the Network Towards Unity for Health, and we, the World Federation of Public Health Associations, are happy to sponsor it together with the International Federation of Medical Students Alliance. You know, for those who are not familiar, the World Federation of Public Health Associations is the umbrella organization of national public health associations worldwide and other affiliated worldwide acting associations that work in favor of public health worldwide. And we are all now at the first day of the World Health Assembly here. I think all that we are here, we have one goal in mind: health for all. Equal health and equal access to health for all. But we are not yet there. And why are we all active and in different parts, and our efforts seem to be not really bundled? That's where the Charter steps in. Shortly, why did we work on a Charter? Or how did it come to this product? We met with Director General Chan 3 years ago. She said, well, public health, you guys, what are you doing today? In today's global setting, what is your task? How do you see yourself? Who should do it? The primary care is, what is the link? And we said, okay, we're taking this task up. We started a long Delphi study, questioning a lot of people around the world. Some are here in the room, and I would like to thank them all. We have been doing extensive literature research, and our education working group has been working on the educational aspect of the question. And at the end, we came up with a charter. You may say charters and resolutions, we had a lot of them, that's true. We have a resolution like Ottawa Charter, Alma Ata, all the classics, but they are mainly focused on one topic. May it be health promotion, may it be primary health care. The Charter tries to embrace it all. The Charter proposes a common framework. It tries to embrace what we all want to do: health, healthy people, health as a human right. And so how to embrace it? It is a political document, yes, because it is explaining the way how we should do it. Working together for a common goal like global health needs functions, enabler functions we would like to call them, and that's why the Charter has, and here is the main slide from the Charter, to come to what in the core is health, protection, promotion, prevention, we need enabler functions. And what you see there, we need an information. As you know, information, knowledge is power. That should be equally distributed, accessible. We need capacity, that means education. And we need then, with this basis, people who are able to do advocacy and governance. These functions are for us the basis of the work we are all going to do. And the people who are going to speak after me is not yet doctor, but very soon, Stintje Dieck from the Netherlands, from the International Federation of Students, Medical Students, then followed by Dr. Marta Lobatzi. She will talk about the information. For sure, a medical student will talk about the education aspect. On my side, Professor Michael Moore, our now president of the World Federation, will talk about advocacies. And on my other side, Dr. Rüdiger Craig from WHO will talk about governance. And I would like to invite now Stintje Dieck to talk about education and capacity. Thank you, Stintje.
So thank you very much. We're all here because we care about health, and we recognize that health is important. But education is something that shapes the way that health is thought of, or how we deliver health care. And if we look back at the world we want, which was an enormous global survey, health and education together were the two major topics, the two priorities for most people in the world. And we all know that health influences us, and health influences people, and the way that people live influence their health. But not everyone worldwide really understands how that exactly works. And if even health professionals don't understand what actually is health or what affects our health, and how can we actually expect this from everyone around the world, whether it's policymakers, engineers, anyone. Whether we're talking about healthcare being delivered at a patient's bedside, or whether we're talking about a policymaker deciding on drug policies, their education, without addressing key topics in public health, will actually not be able enable us to actually provide the healthcare that we need, especially primary healthcare. Now, there are already a number of frameworks that exist, whether it's the Global Consensus on Social Accountability, whether it's the CAMEDS framework. We all recognize these values that are important, but what we really need is implementation on the local level, on the national level, to make sure that actually the people that are influencing health, which is not only healthcare, are actually prepared to actually understand these principles. And now we have this charter that pushes us towards taking health into consideration, taking education into consideration on how we actually prepare people to deal with health in all policies.
Yeah. Thank you.
And now to Marta Lomazzi to talk about the information aspect.
Knowledge itself is a power, said Francis Bacon about 500 years ago. To guarantee a common and equal level of information to all public health professionals and organizations worldwide is a significant challenge. And it's hard work to create information that will reach ministers and policymakers. Without free and equal access to information, there will be no health improvement, certainly not for all. Information equity can be achieved by an even distribution of technologies and resources among social classes, equipped with the necessary skill to understand the information that is being shared. Given that the use of the term global public health has become so common, it's worldwide to take a stop, review, and evaluate how it's been used to create a global, equal, and common vision and understanding of the public's health at the global level. Thank you.
And now to Professor Michael Moore, President of the World Federation, to talk about advocacy. Thank you.
Thank you. It is fantastic to have a charter that sets out for us things that are critical in terms of prevention, promotion, and protection. But of course, to get these things done doesn't happen easily. It takes a coordinated effort from a large number of people. When we carry out our advocacy, it's actually about relationships. It's actually building on what we know and making sure it's delivered. There are many different issues that come in to decision making. That's why it is that we need to be able to influence. And that influence happens when organisations, NGOs, get together, as is happening here today, get together and get a single message which not only convinces our political masters but also gets the public on side. We have always within what we're trying to achieve in health advocacy and through the Charter is health equity. Social mobilisation and solidarity become key elements for getting our agreed message across and getting through to our governments. And it's really interesting to note that Commonwealth Ministers of Health adopted an implementation plan which is based on the Charter for the Public's Health. We can do it, it takes effort, but we have to make sure that the key element to do these good things is based around what each and every one of us does, and that's advocacy.
And now we ask Dr. Rüdiger Krech from the WHO to talk about governance.
it was actually quite interesting to see so many voices when we had this consultation process that said, well, we are actually living in a different world, and in this globalized world, we need to work with other sectors. It's not good enough to just work within the healthcare sector or the health sector, the health system, but we need to reach out. If you look at the current crisis in which we currently live, if I just take the three emergencies we've had currently, we need to work with the security sector. We need to work with the education sector, with the financing sector. All of them have much more to do for health than us alone. There's a couple of elements that governance needs to take into account. The first one is public health legislation. Another issue is, as I said, the cross-sector policy, and if you just look at the Sustainable Development Goals, which we are talking about this year very much in the Assembly, and which we're delighted to do, then this whole agenda becomes very interesting, because in these 17 Sustainable Development Goals, health has very clear links. The way how you build up cities, for instance, has a lot to do with health. A third area is the financing that came out of this governance element. Now, the out-of-pocket expenditure, you all know, actually makes us being part of the problem and not part of the solution in the health sector. We're part of the problem at the moment. 100 million people are pushed into poverty because of catastrophic health expenditures. And so therefore, to also govern this so that we have prepayment mechanisms is important, to also look at public's health. And last not least, it's the transparency and accountability issue. As health has become in many countries the biggest economic driver, it is of utmost importance that we are transparent and accountable, so that every dollar that is put aside for health care is accounted for and reaches the people that the services are for. So therefore, the last aspect of this governance issue is transparency and accountability, and I believe that if we work on those, we will be able to much more increase also the uptake of health services in many, many poor countries. Thank you very much.
I would like to thank all intervening speakers to show how interesting it is that we need different competencies. But we wish and hope that our charter may be helping in all your different actions to do it in a way that is good for you, but that is also a global way for us to come to better health. Our first half hour is over. I thank you all and give over to the Network for the Unity of Health. Thank you so much.